Good morning and good morning. I hope all of you are having a good start to your day. I saw on my news feed an update on Jamie Foxx's recovery. Many of you, perhaps like I am, is are big Jamie Foxx fans, and you heard the unfortunate news about his medical event. It's reported to be a stroke. I'm going to share with you some information on my news feed. I'm sure many of you are following this. And my reason for coming on is one, give you an update. And also, I'd like to give you my perspective. Now, reportedly, he was diagnosed with a stroke. This particular article has interviewed individuals that are very close to him. And he was taken in, initially reported to be a medical event, an emergent medical event. But subsequently, they said he actually suffered a stroke. Someone close thought he may have had a brain bleed. It's thought to be very small, but the good news is that he's recovering. And so, for all of you who are Jamie Foxx fans like I am, it's great that he's recovering. This man is a very young professional, super talent. Comedian, singer, actor. I mean, it's just amazing the spectrum of art forms that he can cover. So the good news is that he's recovering, and he's recovering from a stroke. Now, what I want to do is share with you the whole issue of a stroke and what is a stroke. And I want to share with you some of the things that you need to be aware of. Is oftentimes when individuals who are famous suffer a health condition, we are our attentions raised toward these particular health conditions. And given that he reportedly suffered a stroke, I thought it'd be fair for me to come out and say, or important, I should say, for me to come out and share with you, first and foremost, what is a stroke? And here's some quick clinical pearls in terms of what the risk factors are and ways of preventing a stroke. Many of you may have had family members who've suffered a stroke, and some of the common symptoms of a stroke could be sudden inability to move, sudden inability to speak, sudden problems with eating, swallowing, um, sudden onset of memory loss or inability to think clearly, uh, sudden loss of control of your bowel or bladder. Oftentimes, sudden loss of control of bowel and bladder may be what we call a post-ictal. Ictal, in fact, being related to a seizure. But if you have a stroke, you can have a seizure after a stroke. And so you can lose bowel and bladder related to a seizure event that's happened after a stroke. Loss of control of emotions, depending on what part of the brain that's affected. Effects on the frontal lobe. You can lose effects on control of emotions. Vision losses and things like that. Loss of control of other bodily functions. So a stroke, most importantly, can happen to almost anyone at any time. So when you're around someone or you notice these symptoms that come on all of a sudden, you need to seek medical attention immediately, because the onset of these symptoms could represent the onset of a stroke. And if they do, minutes are very important. Seek medical attention, get to a large medical facility. Many medical facilities can treat strokes emergently and can help reverse these symptoms. So it's really important to be aware of what these symptoms are. But more important than that is to know what are the risk factors. If you understand what the risk factors are, and if you have some of these risk factors, you can probably um, control the risk factors and mitigate the risk factors and prevent suffering a stroke. High blood pressure is perhaps one of the leading causes or leading risk factors predisposing to stroke. If your blood pressure is constantly over 140 over 90, you want to get that checked. You want to do some things to get that blood pressure under control. A known history of heart disease. If you have structural abnormalities with your heart, an enlarged heart, thickened heart, that could be a risk factor for stroke. Many people suffer from diabetes. Diabetes is a risk factor for almost anything cardiovascular wise, and stroke is among them. If you have diabetes, you want to get that under control. I'll share a few points with you in terms of how you can do that. Smoking, just don't smoke. Smoking is a predisposition for cancer, heart attack, stroke. It's a very bad habit to have. Uh, Birth control pills. Many women take birth control pills for various reasons. Obviously, for preventing birth, but also some women take it therapeutically for excess menstrual bleeding. So if you're on birth control pills, know that that's a predisposition for stroke. If you've been diagnosed with what's called a mini stroke or TIA before, that's a risk factor for stroke. That means that you have the quote unquote pathophysiology that predisposes to stroke. If you have a high red blood count, we call that polycythemia. It's a medical term. A high red blood count predisposes to a stroke because it causes sludging in the blood system. And so sludging of the blood decreases blood flow, causes stagnation, and it can create or predispose to clot formation, which again can predispose to stroke. If your cholesterol is high, that's something that can definitely predispose to a stroke because elevated cholesterol, again, is associated with plaque formation. The blood vessels, these are blood vessels in the brain, heart, or any other part of the body. Vascular disease or blood vessel damage in the brain predisposed to stroke. And so that's clearly something that you want to be aware of. And of course, lack of exercise. Many people work long jobs, they're sedentary. Uh, Getting out for a walk 30 minutes or more per day, 4 to 5 times a day, is very, very helpful in terms of improving your mobility. Obesity is another problem. Many individuals are obese, overweight, and obese. There's a high percentage of obesity here in the United States. And just the other day, I did a talk about weight loss and weight control and how optimal nutrition, is really an effective way. So eating healthily, optimal nutrition, plant-based diet, minimal processed foods, and exercising regularly can work against obesity, of course, work against the lack of exercise. It also works against diabetes, also it works against high blood pressure. So just by eating a healthy diet, a healthy plant-based diet, as I often recommend, exercising on a regular basis can actually suppress all of these risk factors for stroke. Excess alcohol use. Again, excess alcohol use works by a number of different mechanisms. One, it could be a direct toxin to the heart. So it can weaken the heart in and of itself. Also, excess alcohol use can cause arrhythmias. Now, I should lump in excess caffeine use with this. So I should say excess alcohol and caffeine use. Many people drink these energy drinks. These energy drinks are loaded with caffeine, and they can predispose to cardiac arrhythmias. Many people often complain of, palpitations or skipping heartbeats when they drink a lot of caffeine or consume alcohol. There's a condition known as holiday heart syndrome, where individuals who will present to an emergency room or a doctor's office and atrial fibrillation after a weekend of binge drinking. And these things can lead to electrolyte abnormalities, as I said, direct cardiac toxicity, and also can affect the electrical system directly. So, excess alcohol, excess um, consumption of caffeinated beverages, energy drinks, or the like can predispose to arrhythmias. And again, this puts you at risk for a stroke. Illegal drugs are always bad. And again, crack cocaine comes to mind. It can have a direct increase in adrenaline, which can then increase blood pressure. It can also have a direct effect and indirect effect on vascular injury. We see lots of individuals who come to the emergency room, certainly back in the day of my training, who would come in with crack cocaine strokes or crack cocaine heart attacks. So these individuals illegal drugs, I should say, can predispose to stroke or heart attack. Abnormal heart rhythm, I alluded to that earlier, but if you have a history of abnormal heart rhythm, particularly atrial fibrillation predisposes to the cause of stroke, and it's something that you definitely want to look at. I'll talk about some of these causes and show you some images shortly. But atrial fibrillation is one of those things that predisposes to stroke formation, and it's certainly something that you want to be aware of. So if you have this diagnosis, you need to be under the care of a cardiologist. We frequently treat patients with medications to control the heart rate in the event you go into an atrial fibrillation episode. And we also have you on an anticoagulant to prevent clot formation. Cardiac structural abnormalities, predisposed to if you have heart failure or dilated heart or an enlarged heart of some type, thickened heart, that can be a predisposition for stroke. Older age, the older we get, the more likely we have these other, risk factors. So if you're not taking care of yourself, over time you're building up, or I should say, you're breaking down your body, you're breaking down your cardiovascular system, you're breaking down your heart. So older age by itself, should not be a risk factor, but because many people, over time abuse their bodies, as they get older, the body's more abused, and so you're more predisposed to these cardiac events, i.e., stroke. More Black Americans have stroke than others because we tend to have more high blood pressure, and high blood pressure is definitely a risk factor for stroke. Gender, more men than women have stroke. Women tend to die more, but more men. And of course, a history of a prior stroke. If you had a stroke before, that means you can have one again. So having stroke is something that we, are predisposed to if we're not taking care of our bodies. Always remember that prevention is the best cure. Now, the key part about understanding what a stroke does, and what I'm going to do is I'm going to share some images with you, just a few, just to share with you what exactly how the mechanism of a stroke can occur. And these are just some cartoon images that I'm going to share with you. Just 1 minute, because it's best to understand the anatomy. A picture's worth 1,000 words, and understanding how this mechanism occurs is there. So here's a little picture of someone's brain. And notice that you have the head, you have the neck, and you have great vessels in the neck here. And blood flows up to the brain. And so when blood goes up to the brain, it feeds oxygen and nutrients to the brain. And when this process is working normally, everything is great. However, if you compromise that blood flow somehow, then that's when you're predisposed to a stroke. That's really the mechanism of a stroke. So compromising this brain flow and brain function is something that we want to be aware of. And so as flow goes, we want that flow to be nice and normal and fluid. So what are some of the things that can compromise the flow of blood to the brain? One, plaque causing a thrombus or stroke. So as I said, increased cholesterol, increased blood pressure, that causes injury to these blood vessels. So if you develop plaque, as you see here, you impair blood flow to one branch, and brain tissue distal to here gets compromised. If there's a sudden shut off, like with an ischemic stroke, a clot can form here, or a clot can embolize from the heart, then it cuts off blood flow, and then you have symptoms of a stroke. These are the most common cause. However, you can have hemorrhagic stroke. It could be hemorrhagic stroke from an aneurysm. So an aneurysm is an out pouching, a breakdown of the wall of the artery. So you have an out pouching of this blood vessel wall, and this blood vessel wall is compromised, and you can bleed here. And so you can have a subarachnoid bleed. You can have an arterial tear, intracerebral bleed. That's within the muscle itself. The subarachnoid bleed is sort of on the outside and in between the lining of the covering over the brain. And people have, with a subarachnoid bleed, people can have what's called the most severe headache they've ever had. And oftentimes you do a lumbar puncture, somebody with subarachnoid bleed, you'll see blood in the spinal fluid, because it's sort of around the outer covering of the brain, as opposed to the intracranial bleed is there. Now, subarachnoid bleed, if you bleed rapidly around the brain, it can compress the brain and cause a compromise in flow there. Um, so essentially, these are some of the mechanisms um, here. Other cause of stroke: ischemic stroke, hemorrhagic stroke. Another summary there. Subarachnoid. There's another image here. You can see with atrial fibrillation, you see blood clots that can form in what we call the atrial appendage here. And so if the atrium is fibrillating, so normally the heart chamber squeeze in sequential evidence, so in sequence. So the upper chamber squeeze, the lower chamber squeeze, contraction upper chamber, contraction lower chamber. However, what happens is that when you have the upper chamber not contracting very well, it fibrillates. So, for example, if you get the upper chambers contracting sequentially, contraction upper chamber, lower chamber, then you have fluid flow. However, if the upper chambers are fibrillating, then you have sloshing of blood around the chamber. And so what happens is that this sloshing effect causes blood to become stagnant and it becomes clotted. And so when you have clotting of the blood, it builds up in little pockets. And one of these pockets are called, well, there are two pockets in the upper chamber. One's on the right, it's called the right atrial appendage, and one on the left called the left atrial appendage. And so the left atrial appendage is a critical part because you can get clot formation there. In fact, in individuals who are in atrial fibrillation, and when we go to do elective cardioversions, in other words, a cardioversion is when we shock the heart from atrial fibrillation to a normal rhythm. What we typically do is that we will take them to the lab and we do what's called a transesophageal echo. You know, trans across esophagus, the bleeding tube. So we do an ultrasound across the feeding tube, rather, not bleeding tube, the feeding tube, looking at the back of the heart, which is where the left atrium sits. And so you have the left atrium, and we can look at the left atrial appendage. We get a close look there. We look for blood clots. If we don't see any blood clots, you can say, okay, it's safe to do the cardioversion on this patient. So this is where we're looking when we're doing this procedure. And it's important because when we do a cardioversion from atrial fibrillation sinus rhythm, we don't want there to be a clot. If there's a clot, we won't do the procedure. We'll adjust the blood thinners so that the body will get rid of the clot first, either dissolve it or wall it off, and then we'll do the cardioversion with that. So this is an area of interest when you're dealing with a blood clot. So I wanted to just share that with you, give you some insight into the mechanisms of a stroke. But more important, you should know the risk factors. The risk factors are what you can control. And notice just about all of the risk factors on there are controllable. I mean, yeah, there's another risk factor called family history. I did not list that one because, yes, a family history is a risk factor. However, it's really your underlying genetics, but the epigenetics. So even if you have family members who have suffered from a stroke, if you control your lifestyle aggressively, you don't have to be at risk for a stroke. So it's really important to understand that. And I thought I would take the time to bring this information to you because stroke is very common. We're seeing many more people, younger people, with stroke. Mr. Foxx is just one of them. But we're seeing lots of young people who are apparently healthy and young and fit, but are coming in with diagnosis of stroke, symptoms of stroke, mini stroke. And I just want to make you guys aware that you can be empowered. It's time to be more vigilant with the health practices. Is be more intentional about the foods that we eat. Be more intentional about the foods that we don't eat. Let's also be intentional about exercising. We're intentional about lots of things that we do in our lives. We're intentional about running our businesses and doing various other things. We need to be intentional about how we take care of our bodies. Let's not smoke. Let's not do illicit drugs. If we have low energy, don't cop out. And also, drink, energy drinks. Take care of our bodies. Drink blue green algae. Drink, superfoods. Consume superfoods that gives you energy naturally. So if you take care of your body will take care of you. And again, I want to say our thoughts and prayers goes out to Jamie Foxx and his family, and we wish him a speedy recovery. But I would like for this to be a lesson for all of us. to be very intentional with our health. And again, if you like this, please give us a thumbs up. Help us out on the YouTube algorithm. I'll be coming with you with many more Dr. Montgomery's clinical pearls to help you make the ideal lifestyle decision. So until next time, take care of yourself, and I look forward to seeing you on the next video.